The procedure on the opposite side of this record is the one I have taught to thousands of physicians who are using it successfully in their practices every day. Let me tell you something about medical relaxation. The words medical relaxation describe a state which has been misnamed for several hundred years. There has never been a good name found for the state which I teach doctors to obtain with their patients. We know that the state is one of deep relaxation. And it is so easy to obtain this deep relaxation if you approach the patient in the proper way. Approach your patient something like this. Mrs. Jones, if I could teach you how to relax, do you realize that you could have your baby with an absolute minimum of pain, perhaps none at all? And Mrs. Jones is sure to say, well, doctor, teach me how to relax. And all you have to say is, I can teach you the medical way to relax if you will just follow my orders. In fact, I can teach it to you so very easily. I could have you sit down on that chair over there and just listen to a phonograph record. Now, all you have to do is to follow the instructions on the phonograph record, and you learn how to relax medically. Just by listening to a phonograph record, you can obtain as deep a state of medical relaxation as you want, and you could have your baby that way, and you would have that baby with an absolute minimum of discomfort. Well, then she wants to hear the record. So you tell her to sit down comfortably in a chair. Just sit down as comfortably as you can possibly sit down, and just stretch out and do exactly what the record tells you to do. And I'll listen to the record here with you. For if she follows the instructions, she will obtain that deep state of relaxation. Now suppose the record is played for about a minute or two, and you see that she's not following the instructions on the record. You stop the record, and you say to her, now, Mrs. Jones, this is up to you. If you want to have the benefit of relaxation, then you must learn how to relax properly. You've got to do what the record says. I want you to imagine that that's my voice on the record, that I'm talking to you, and you're just doing as I tell you. Do you think you could do that? And she'll probably say, yes, I think I could. And then you say, all right, now let's start this record over again. Do exactly as it tells you to do, and that's all you have to do. If you just follow the orders on that record, you'll find yourself feeling so good in a few minutes. Now, in a few minutes, if she follows the orders on the record, she begins to be medically relaxed, and the state is one of such grand euphoria that before long she is enjoying the state tremendously. As she enjoys the state, and because she enjoys it, she goes deeper into it as she follows further instructions. In a little while, she is in a deep state of medical relaxation. Now, there's another thing you must know about medical relaxation. It is not a state of unconsciousness. It is a state of keen consciousness. There is not dimmed awareness. There is increased awareness in the state of medical relaxation. Therefore, the patient hears the words which you say much more clearly, and they land so much more emphatically in her mind. Eliminate all words such as hurt and pain, because with the increased awareness which medical relaxation brings on, she hears those words so clearly, and they seem so important to her, that what would ordinarily cause her to tense and feel hurt or pain causes her to feel pain and hurt about 2,000% more if the wrong words are used. Therefore, stay away from all words that paint a picture of pain. For example, stay away from words such as knife, needle, sharp, incision, stitches, and so on. One of the most important things about obtaining the medically relaxed state is to have confidence when you do so. Confidence is the keynote of success. Believe it will happen, and it will happen. Start conditioning the patient at any time, even up to and including actual labor period. But of course, catching a woman in the midst of labor and conditioning her for a relaxed delivery must be done by those men who are expert in the field and know medical relaxation thoroughly. For the novice with the subject, it is best to begin when the woman first begins to show signs of pregnancy rejection. I'm talking now about the nausea and vomiting of pregnancy. Suppose a patient comes into your office who is showing those signs. A most amazing thing will happen if you tell her to just sit down and listen to this record. That if she will relax, that you can promise her, almost with certainty, that if she just listens to that record, her nausea and vomiting symptoms will entirely disappear, and she'll feel like she hasn't felt in months. She'll feel so good. She'll scarcely believe that will happen. Neither will you, probably. But when she sits down and listens to the record, an odd thing happens. When she relaxes, the way she is told to do on the opposite side of this record, we bypass the critical factor of her mind, and we establish selective thinking. The critical factor of the human mind is that part of your mind which tells you that hot is hot and cold is cold, and pain is pain and hurt is hurt. This critical factor is bypassed through various techniques used on the opposite side of this record, and suddenly we find that we are able to establish the type of thinking we want. That is, that there will be no vomiting, that there will be no nausea, and that she will feel wonderful when she opens her eyes again. All this will happen if she merely listens to the record. It is not only important that you have the patient listen to this record 2 or 3 times during her pregnancy, but it is also important that she practice relaxation at home. I would suggest that you have her listen to the record, say, every 2 months during the time of her pregnancy. Then give her one of the relaxation records to take home so that she can practice relaxation and learn auto-suggestion, so that she can give herself suggestions for the relief of any discomfort which she might have during the actual delivery. Now, as to what will happen in the delivery room. Be sure that you do not take the patient by surprise. Keep the patient apprised of what you are doing at every step of the road. Remember, she may have her eyes closed, but she is perfectly conscious and aware of every word you say. And so should a nurse come along and say, "Well, I don't understand it. She looks awfully relaxed while she's having those contractions, but you can't tell me she won't have some pain." And chances are the patient will begin to have pain. Therefore, you must warn your delivery room nurse that she is not to say a word that interferes with the semantics of medical relaxation. Suppose you are working with your patient in the delivery room now. She is thoroughly relaxed, but you begin to sense that she is feeling things. You can add your own words of nothing's going to bother, nothing's going to disturb. You're going to take those contractions so easily, and they will be so pleasant. In other words, reinforce what you hear on the opposite side of this record. Make her believe that those contractions are pleasant, and they will be pleasant for her. Suppose, despite all you say and all you do, the patient doesn't respond in the delivery room. If you will just tell her to relax, just as she learned to do on the record, and follow your orders, She won't feel a thing because you are going to give her every scientific help that medicine has to offer to make the birth of a baby easy for her. Then you will find that she will calm right down, and with much less anesthesia than you would ordinarily use, you will be able to complete the delivery. You will be able, in many cases, to do the episiotomy, the delivery, and the repair without any anesthesia whatsoever. And the patient will not even feel what you are doing. Be sure that after the baby is born, you say to the patient, when I have you open your eyes and rouse you from this relaxed state, you're going to feel better than you've ever felt. You're going to feel wonderful. There will be no loss of strength. You're going to recover very quickly, and you're going to feel just grand. You don't have to use those exact words, but words very like them. Why is it important for you to give health suggestions when you are rousing her from the relaxed state? Because in this relaxed state, she can give herself auto-suggestions. And if she gives herself a suggestion that having a baby is a tough thing to have, she is going to feel all the after pains that she can suggest on herself. But you can prevent those so-called after pains by the words that you say when you are rousing her from the relaxed state. Another thing, don't worry if the patient during the course of delivery several times opens her eyes. That doesn't mean a thing. She is just anxious for the birth of her baby, and occasionally she'll forget that she isn't supposed to open her eyes, and those eyes will open. Just tell her to close them again. But you can do one lovely thing for her. The instant the baby is born, tell her to open her eyes and see that baby. You'll be surprised how much that will help you and how much it will help her. And now, play the record on the opposite side of this one for your next OB patient.